SafeScript New South Wales is a digital information system that provides prescribers and pharmacists with real-time information about monitored medicines that are being prescribed or dispensed for their patients.
Being a community pharmacist, there are so many extra demands on my time. So having SafeScript there, it's so easy and convenient. You log in, the information is there, you can make an informed decision.
Well, where the prescriber or pharmacist uses integrated clinical practice system, then the SafeScript system will provide a pop-up notification or an alert. Those high-risk situations may be where there is multiple prescribers involved, where there are high doses of opioids being prescribed, and where there's co-prescribing of monitored medicines of concern, such as opioids and benzodiazepines being used together.
I find SafeScript New South Wales being very quick in terms of giving me access to the information I need, and I also find it very useful when I can differentiate the information based on either the prescriber or the dispensed view. Sometimes it is more important to look at the dispensed view rather than the prescribed view, because not necessarily all the scripts which have been issued to a patient would have been dispensed, and that makes a huge difference in terms of clinical decision making.
SafeScript New South Wales bringing transparency of who's involved in a particular patient's case is fantastic, because it really is bringing all the team together to get the best result and the safest result for the patient.
Certainly some patients are concerned, and confidentiality and privacy is one thing, but also they can feel, oh my gosh, I'm going to be given a hard time by the doctor, I'm going to be stigmatised, or I'm not going to be able to get my medications. And so, some of them can be quite concerned about what this is going to look like. And so it is really important with those people to have a conversation about why you're doing it. So certainly if I'm seeing someone for the first time, absolutely, if they're not known to me, I don't have that strong therapeutic alliance, I'm going to be wanting to check SafeScript, if it comes up, and if it's appropriate given their history. Because that allows me once again to have that objective evidence that helps us to form an alignment together, and that therapeutic alliance going forward is really important.
For those prescribers and pharmacists who are not using integrated clinical systems, they may access SafeScript New South Wales directly through a web-based portal. So once the information is available to the practitioner, they then decide what the treatment plan for the patient will be based on the information available. We have a range of training materials available for prescribers and pharmacists, which will assist them to learn how to actually use SafeScript New South Wales, and also provide information on management strategies for those patients who are identified at risk of harm through the use of the SafeScript information.
SafeScript New South Wales perspective, it's not just about the real-time monitoring. There are a number of very valuable resources that back this up. There is a clinical advice line that people can dial in if they want further advice, and that can access pain medicine specialists or mental health professionals. There are e-learning modules available, and there are links to health pathways as well. So a number of resources available to help the prescriber in these situations.
The monitored medicines that are captured in SafeScript New South Wales are all Schedule 8 medicines, so including opioids and psychostimulants, but also codeine, benzodiazepines, and the other medicines that need careful monitoring of doses, duration of use, and co-prescribing.
Takes the guesswork out of clinical decision making, especially when there is an index of suspicion in those patients who might be underreporting some of their use of different medications. It helps me to initiate conversations which might be difficult and challenging for the patients based on the information we have gathered from SafeScript New South Wales. This in turn will make prescribing better for those patients and make it safer for them.
A patient's relationship with their GP is, I think, the cornerstone of the health system. I want to know that I'm in the centre of someone's decisions as a doctor or as a chemist. I want to know that they're thinking about me, that they're actually looking at my medication, they're thinking about how it's going to react with me.
It's only going to make your life easier. This isn't a burden. This isn't like extra paperwork. This is something that's going to make your day-to-day practice so much easier and better. Just do it.
Access to SafeScript New South Wales has been made available as part of New South Wales Health's commitment to reducing harm from use of monitored medicines, and it's part of multifaceted strategies to reduce the risk to our patients.